actually look like when your waters break? Well, the truth is, it's not always a dramatic gush like you see in the films. For some people, it might just be a slow trickle, just like this. You might just notice a bit of wetness in your underwear. For other people, you might get that proper gush. So if there's a big break in that bag of fluids, when the waters come out, it might come more like a gush. This can soak your entire underwear, run down your legs, look more like what people typically imagine their waters breaking to look like. And for other people, that bag of water may never break. They don't see their waters breaking, but they continue to have contractions. And the baby may even be born in that sack of fluid. So you might feel a popping sensation, a slow, steady leak, just some wet underwear, or you might not notice anything at all. Now, once your waters have broken, they're going to continue leaking all the time. So every time you stand up, you'll feel a bit more water come out. That's normal, don't panic. Amniotic fluid itself is usually clear. Maybe not quite as clear as this water, but it might be a bit straw coloured, so a bit yellowy, and has a bit of a sweet smell. I can tell you that midwives and doctors can often explain they can smell amniotic fluid. It doesn't smell like urine. However, sometimes that fluid can look different. It might be pink tinged, meaning there's a very small amount of blood, which can be normal in early labour as your cervix is opening to have a tiny little bit of blood. So pink stained fluid wouldn't be of concern, but if it's bright red, so that indicates fresh bleeding, that is of concern. Also, the fluid might be green or brown, and that can indicate the baby's done a poo inside called meconium. Definitely if you see green water, that needs medical attention. And then you can have cloudy or foul smelling fluid. That can indicate an infection and again should be checked urgently.